Toria Welch, and I'm a current student at Columbus State University. I will be presenting preventing falls in hospitals. Falls can be very detrimental to the patient. This can cause injury, death, possibility of prolonged hospital stays, and the cost to treat the injured patient. Contributing factors for falls could be history, medical history like seizures, um, loss of conscience, medications such as sedations, opiates like propofol, which is a sedation medication. If the patient is trying to wake up and not oriented, that can increase the fall. Or if a patient taking morphine or Dilaudid for pain and decided that they want to get up and use the restroom, those type of medication can cause falls as well. Valproic acid that they use for seizures can cause falls. So it's very important for the nurse to review the patient medications. It's also very important for the nurse to view how the patient is walking, the gait, to make sure the patient is not unsteady when he or she walks. That could be a cause for a fall. And immobilization. If a patient has, immobility. If the patient has a cane, a walker, those can be increases chances of falling as well if they're not using it properly. Um, Other factors that can contribute to fall is miscommunication with the patient family, and staff. Nurses not being aware of the situation. If you're not being aware of your patient's symptoms, if the patient came in with complaint of dizziness, lightheaded, blurred vision, if you're not aware of the situation, that puts the patient at a higher risk of falling. Um, Lack of teamwork among staff. If your CNA doesn't know that your patient is a fall risk, if your other coworker doesn't know that your patient is a fall risk, that put the patient at a risk of falling. Not enough roundings. If you have a patient that's, let's say, just was given moderate sedation like fentanyl or Versed, which can impair a level of consciousness, and they're coming out of it after getting their shoulder popped back in place, and no one is there to make sure their vital signs are stable or the rails are up, and they decide to get up and fall. That's a risk. Moderate sedation is a risk as well. Not enough rounding, meaning if you're not making enough rounding on your dementia or confused patient, that patient can easily get out the bed, walk the halls, fall. And most insurances like Medicare and Medicaid um, quote these as preventable causes. And some of them might not even pay for the cost because it's preventable. We have a scenario where we have a 62-year-old male that came into the emergency room with the complaint of dizziness, lightheaded, fatigue, vomiting, and diarrhea for 3 days. He has a history of type 1 diabetes and high blood pressure. His vital signs show that his blood pressure is 92 over 60. Heart rate is a little elevated at 115. Temperature is 98.2. He's statin on room air at 100%. So the nurse gets him to the room, get him undressed, have him placed on a gown. She put him on a cardiac monitor to monitor his vital signs. She also get blood work, and she initiated IV. Once the nurse initiated the IV, she started normal saline on him to rehydrate him. So the nurse left. The patient decided he had to use the restroom, but the call light wasn't at reach. So the patient decided to scoot down the bed. In the process of scooting down the bed, he ended up pulling his IV out, which caused fluid to be on the floor. Once the patient finally got out the bed, he slipped in the fluid that was drained from the IV. This all could have been prevented if the nurse would have put the call light at reach. Preventative measures. It is important to make sure that the bed is at the lowest position. The patient needs to make sure you have the patient on the yellow non-skid socks. that belongings are at reach, like his eyeglasses or hearing aid. You need to make sure the call light is at reach. You need to make sure if family is present, educating them on preventative measures as far as falling. If they're both side rails up, you need to make sure again that the call light is at reach. Like in a scenario, the patient can get out the bed, so he decided to scoot all the way down, which caused the IV to come out his arm, which caused fluid on the floor, which caused him to fall. So as the nurse, you need to make sure you educate. If you need me for anything, this is the call light button, match the call light button. Me or my coworker or the PCT will be right with you. Again, this is the fall risk. So if you have a patient that's considered fall risk, once you do your fall risk assessment consists of knowing the patient history for falls, knowing if they have IVs, checking their gait, checking their mental status, making sure they're alert and oriented. If they're not, they're considered as fall risk. If so, they need the yellow wristband, they need the yellow socks, and then on the door, you need to put fall risk so it'll alert your other co-workers that this is a fall risk patient. So, keep a lookout for this particular patient. And it's always important, like in the emergency room or in any unit, to make sure that the light is adjusted for that particular patient. Make sure it's not too dim so they can see where the trash can is, where the bathroom door is, where's the front door, or if any cords are on the floor. It's always good to make sure you keep cords out the way. But if that's not the case, like the IV cord, it might have just dropped on the floor. You want to make sure that the patient can see it visually with light. It's always important to review medications. Like I said, certain medications can cause dizziness. It can cause drowsiness. So it's important as a nurse to know which medication the patient is on and which medication you're giving the patient while they're being admitted into the hospital. And before leaving the room, most importantly, please educate your patients on the risk for falls and how they can reach you or another staff member if they need assistance getting out the bed. There are plenty of organizations that implement fall risk. Like according to the American Nurse Association, they implement fall measures or important outcomes by several organizations like the Joint Commission. Joint Commission requires all accredited hospitals to do fall risk assessments on their patients. The fall risk assessment consists of fall histories, the medications, if they're oriented, how they're walking, their gait. Those are graded on the higher the number, the higher the risk of the patient falling. Then we have the National Database of Nursing Quality Indicator, which actually collect data from different units on how many falls, and then they actually implement improvement programs to prevent falls in the hospitals. Conclusion. One fall can change a person's life in an instant. It's very important for a nurse to do a fall assessment on every patient that enters the hospital. It is also, if that patient is deemed a fall risk, it's very important for that nurse to implement the fall risk procedures. Falls can be preventable with the proper interventions. If you have any questions, my name is Frantoria Welch. The end.